As parents and students all get ready to return to school, a national analysis is showing a 90% jump in children with COVID in the last month. But North Texas is seeing something a little bit different. Our Caroline Vandergriff begins our coverage tonight.
Doctors say the amount of pediatric cases tends to mirror what's going on in the community. So if there's an increase in the number of adults with COVID-19, there's going to be an increase in the number of kids as well.
That kids get COVID. They can spread it, they can get it from their parents.
Cook Children's has tested more than 14,000 children for COVID-19, and 993 have been positive. New numbers show the Fort Worth Hospital's daily positive case count peaked in July and has actually been declining ever since.
I think in our case, that definitely reflects that the numbers are going down, that we're seeing a lot less disease in our area, which makes sense because, we paused reopening.
In Tarrant County, children under 15 years old make up just 6% of cases. Teens and young adults ages 15 to 24 account for 17%. In Dallas County, there's been a steady rise in the number of kids with COVID-19. Children ages 0 to 17 made up just 2% of cases in March. So far in August, that's up to 15%.
Well, most kids respond very well. After a few months, they're back to their normal state.
But there have been more severe cases.
It may be only one out of 300 kids or so that ends up in the ICU, but if that's your child, that's the one that counts.
Cook Children's currently has 5 COVID-19 patients in the hospital. Children's Health has 13. With many kids headed back to the classroom this month, those numbers will likely go up.
I think the schools may reopen. There might be a calm before the storm. I hope it's just a very small storm.
Doctors say there's not a one-size-fits-all solution for sending kids back to school. They recommend talking to your child's healthcare provider and also their school district to weigh the risks and benefits. Caroline Vandergriff, CBS 11 News.